And today I'm going to be talking a little bit about our Sister Friends program, which is really built to address the issue of infant mortality in Detroit. So in Detroit, the infant mortality rate is twice that as the rest of the state of Michigan. And when you just talk about African American babies in the state of Michigan, they die at a rate that's 3 times as high as white babies in the rest of the state of Michigan. And if you're just talking about premature babies, 18%, that's almost 1 in 5 babies in Detroit are born prematurely. So infant mortality is absolutely something that's of concern for us in the city of Detroit. And so what we've created is a program called Sister Friends. And I say it's a program, but really it's a movement. It's a movement that really addresses the social context and provides a social support for pregnant mothers in the city. And it's really built on the strengths of the community, which are the people. It matches volunteers, and anyone can be a sister friend. As long as you care and want to support a pregnant woman, you can be a sister friend. And you essentially support a pregnant mother through the pregnancy, through the delivery, and through that baby's first year of life. In Detroit, we know that there are over 100 programs that address the social determinants of health and really help support a young woman who is pregnant. But what's often missing are those connections and that support so that women can actually get to those services that exist. So again, the Sister Friends program is not really a new program so much as it is a social support. So what do I mean by that? In Detroit, we have a very large geographic space. It's very large. The city was actually built upon the expectation that everyone would have cars. Unfortunately, a lot of folks in Detroit actually don't have access to a car, and there's also not a robust transportation system like you would see in a city like New York or even Washington, D.C. So what that means is that there are issues of access in Detroit, and even young women being able to get to their prenatal appointments and being able to access other services. So what a sister friend does is actually help provide that support, help them get access to the transportation. They also help their pregnant mother who they're associated with. They help them get access to insurance. We actually have community health workers that are situated in our prenatal clinics that actually help those pregnant mothers connect to other programs such as our Women, Infants, and Children's program, so WIC, also connecting them to transportation. So we actually have a partnership in the city where we are providing free transportation for pregnant mothers to all of their prenatal appointments as well as their child education classes. Sister Friends is really part of a larger health department strategy and city strategy to address infant mortality. So what we've done is actually worked with our hospital systems, we've worked with our faith-based community, we've worked with our Department of Transportation, we've worked with our home visiting programs, really to connect them all. So there's something in Detroit called 961 Baby. And anyone who's pregnant can call 961 Baby and they can get access to, or they can get information about all of these various programs that happen, but that are in existence. But often what happens is they are unable to, whether it's because of child care issues, transportation issues, or quite frankly because they can't take off of work to get to them. And so what we've done with the Sister Friends project is really being able to connect women who are having difficulty with accessing those services, helping them to get access to them. So often they don't have insurance, or they can't make it to their appointments because of child care issues, or they're actually not even in prenatal care yet. You can actually be in the Sister Friends program, but not yet have a doctor and have access to prenatal care. Or you're having difficulty choosing a pediatrician for your child after they're born, or you have questions about breastfeeding. And of course, we support it and recommend that all women breastfeed. And so that connection of Sister Friends is really to help bridge that disconnect between the pregnant mother and the many services that exist. So it's really a mentor, it's a partner. If you are having any questions about your pregnancy, you have questions about what to expect when you deliver, it's really like a best friend almost that's there just to support you through your pregnancy. So who is a sister friend and who can be a sister friend? So a sister friend is really any woman who's in Detroit, in the Detroit area, who cares about and wants to support a pregnant woman through pregnancy. We do background checks, of course, but it's really anybody can be a sister friend and you're a volunteer. So what does it mean once you sign up to be a sister friend? You actually go through a brief training, so a 3-hour training in the health department where you learn about all the different trimesters of pregnancy and how you can support your pregnant mother through those different trimesters. What you also receive as a sister friend is a packet and information so that if your pregnant mother who you're supporting has any questions, you know easily how to connect them to the various services. What's also exciting about the Sister Friends program is, so we don't expect a sister friend to be an expert. These are not doulas, they're not healthcare professionals, but we also have community health workers that are part of the Sister Friends project that are situated in these prenatal clinics. They're situated within our various community partners, so some of our churches where we actually have the Sister Friends meet regularly to talk about their experience as Sister Friends and some of the challenges that they may be experiencing and helping to support one another as they're going through this sister friend experience. So we actually have community health workers who lead those groups, and we call them bunches, but we actually have community health workers who lead those groups and also are the ones that are the backbone of the program that are connecting the woman to the insurance, to the home visiting, to the child care education classes. We also have programs where actually every pregnant mother is going to get a municipal ID card. So often some of our women, some of our most vulnerable women also don't have a driver's license. And so that really impacts how they're able to access services both in Detroit and across the rest of the state. So actually all of our pregnant mothers in the Sister Friends program will be able to get access to this municipal ID in the city so that they can have access to other important services throughout the state.